is a handover procedure. Infection prevention, you perform your hand hygiene. You can use soap and water to remove soil in your hands. Alcohol hand hygiene, you abide by the 5 moments of hand hygiene before touching a patient, after being in contact with a patient environment, after touching a patient, after aseptic procedures, and before any bodily fluids. That's supposed to be here, but it's not. Okay. Abide by the bed below elbows, no watches, no rings, wear preferably short sleeves, provide privacy and confidentiality. According to the Occupia Act number 4 of 2013, nurses or other healthcare workers don't have the right to disclose of a patient information without consent from a patient. Nurses are not allowed to expose the bodies of the patient during procedures, so it's preferably, if you're gonna wash the patient, you hide the parts that you're not working with. Nurses are not allowed to share patient documents. The patient has the right to take legal action if he or she feels that their privacy has been violated. Informed consent, preferably give a consent form if there is a need. Introduce your assessors and verify your consent. Identification, identify your patient. Use ID bands, white one which is a general ID band to identify the patient, a yellow ID band for allergies and comorbidities, a pink ID band for any procedures that need to be performed on the patient, a red ID band to identify if the patient is at fall risk, and a green ID band if the patient has a stroke. Ask the patient to re-identify themselves. You would just sort of like ask them, sorry ma'am, can you tell me your name, surname, and your address, just to see if they know who they are, they know where they're coming from, they have an understanding, they are alert to the surroundings also. I think that would help as well. And to also confirm with the file if they are the person who's in the file, who's written in the file, is the same person that you're talking with, communicating with. Relevant acts and institutional policies, which is your Batu-Pele principles, your Nursing Act number 33 of 2005, your National Health Act number 61 of 2003, regulations, which is your R767, your acts and omissions, R2598, your scope of practice, R171. Okay, so with your allergies, you ask the patient to verify with the files so that he can verify with the file if they have any allergies. Ask them what triggers these allergies, and when they last had an allergy attack, what interventions were done. Okay, you ensure that your patient is comfortable, so you would ask your patient if they need to use the toilet, if their possessions are close to them, if they are, the way they are positioned is comfortable for them, are they experiencing any pain, is the environment peaceful for them, or is it giving them a migraine? You ensure that the environment is safe. You check is safety equipment, that it's working, the suction, the emergency trolley is checked daily, ensure that the call bell is within reach of the patient. You manage risks prior to handover. Ensure that the room is clutter free. The bed breaks on the bed are on, so that the patient doesn't is not in any kind of risk of like the bed moving. Ensure that the patient is close to the toilets. And there's water within reach of them. Now the pose of a handover. It is a total clinical review. It determines and it evaluates the treatment and a response to the treatment. It coordinates, it helps nurses to coordinate activities for the day. It evaluates that the patient is safe. It evaluates the patient's emotional state. It determines safety risks within the environment. Some of the barriers to handover is a lack of shared information between nursing staff on importance of a handover. It is settings that are not conducive for a handover. For example, if it's too noisy, if the people that are supposed to be attending the handover are not there, all there, then they won't know what's going on. If there are interruptions by other people, it's I wrote that by the multidisciplinary team, but I feel like it doesn't have to. Interruptions can come from anyone. They can come from patients within the hospital. They can come from visitors. So any interruptions, okay? Time constraint. If there's not enough time, for example, if people are late, then there will be a time constraint. Then they may feel like the other person may want to leave and the handover may be rushed. If there's missing information, if people don't share everything during a handover. Employ strategies to improve the handover. What things that we can do to improve it is that we can perform a handover face to face. We can perform a handover at the bedside of the patient. We can choose an environment that is free from distractions. Prioritizing. We can prioritize high risk patients. Can ensure that we have specified times for a handover and everyone is present. We can use a language that is clear that everyone understands. We can encourage the patient to participate in the care, and that is very important. Identify areas of concern. Patients who are insulin dependent have to be attended to as soon as the handover is complete. People on insulin need to receive their dose before breakfast. Ensure all people are getting to theater. All people going to theater are attended to, and the file is done. Okay, and you would have your pathophysiology, your nursing diagnosis, and your nursing interventions in place. Principles of handover, you will write the type of unit that you are working in, how many patients are there. That's not acuity, that's acuity. What is the acuity being applied to that ward? How many admissions are there in a probably day or week or month? How many discharges and transfers are there? Are there any isolations? How many are those isolations? Delegation and allocation versus staff competence. Is the patient file there? Is the handover bed list present? Delegations and allocation forms, are they present during handover? And obviously during handover you have to say the patient's name, surname, age, allergies and comorbidities. How long have they been in the hospital? What is the treatment plan? Are there any diagnostics on admissions that were done, or will there be any diagnostics that will be done? What are the normal and abnormal and rational and the rationale for investigation? So during those diagnostics, what did you find out? What is the patient's medical diagnosis? How many days have they been in the hospital? And how is the vital data? How is it trending? How is their vital data trend? What is their GCS? Are they in any pain? Is the intake and output balanced? Does the patient have any IVs or invasive devices. Are there any concerns with regard to those devices, or are they still in a good condition? How is the emotional state of the patient? Does the patient have any religious or cultural restrictions? What is their VTE? What is their Waterloo score? Are there a fall risks? What actions have been done about that? Progress since admission. Has the patient been progressing since they were admitted? Outstanding actions. What actions need to be done for the patient? Health education, that will depend on the diagnosis of the patient. Ensure to document